I'm sorry you didn't have a good day at school today.
Mommy, I don't feel good.
I know, sweetheart. But I have an appointment this afternoon at the new patient-centered medical home for follow-up for my neck surgery. Let me call them and see if they can get you in, too. Hello, yes, this is Stacy Jones, and I have an appointment this afternoon, follow-up with my neck surgery, and I was wondering if you could get my daughter Emma in as well. 4:30, perfect. We'll see you then. Thank you so much. They can get you in the same time as Mommy with Miss Sarah.
That's great. I like Miss Sarah.
I know you do.
Hello, welcome to Generations Patient-Centered Medical Home. A patient-centered medical home is a new model of care that is to provide comprehensive and coordinated medical care for patients. We are Joint Commission accredited, and we're very proud of that. It was a hard accreditation for us to earn. The patient-centered medical home, it's not the building, it's the team of professionals who come together to serve the needs of our patients. Well, hi, Stacy and Emma.
Hi, Mary Sue.
Oh, you're looking good after your surgery.
Thank you. I'm feeling much better.
Well, good. I'm so glad. And I hear you've been sick today.
Yes, it was so convenient to be able to get her in with my appointment this afternoon.
Well, we want to take care of you. Now, I think that Miss Sarah's ready to see y'all in the back, so let's go on back,
All right,
okay?
thank you.
Okay, let's come on back.
Hello, I'm Sarah Compton. I'm a nurse practitioner at Generations. Generations is a new model of patient care called the Patient-Centered Medical Home. I lead the healthcare team here. Let's go in and see my next patients. I'm their personal primary care provider. Hi, Stacy and Emma. How are you guys doing today?
Good.
Good. Stacy, I got your operative notes from your orthopedic surgeon. Seems like your surgery went pretty well.
Yeah, that was quick. That was only like 5 days ago.
I know, we get all of our records electronically now. We send and receive them all electronically, so we get them almost instantaneously from the time they're transcribed.
Neat.
That's great. We got your discharge summary and medication reconciliation also from Dr. Smith, and doesn't seem like they made any changes in your medication.
Mm-mm.
That's great. That's great. I'm going to check your blood pressure. That's 110 over 80. That's fantastic. And I see I got your, in your discharge summary, it said that they didn't have to make any changes in your blood pressure medication.
No, ma'am.
That's great. And let me take a look at your incision. That looks really good. It looks like it's healing well. There's no drainage. No signs of infection at all. Oh, excuse me, Emma. I'm sorry, baby. Take some deep breaths. Good. Deep breath again. That's great. I also see here on your records that you will prescribe some Percocet for pain. Have you had to use it much?
Yes, ma'am. A little bit more than I thought I was going to have to.
Well, you know, sometimes those pain pills can cause constipation. Just be sure and drink plenty of fluids, increase your dietary intake of fiber. If constipation does become a problem, you can always resort to taking Metamucil or Benefiber if you need to.
Okay, great. I'll keep that in mind.
Good, good. I also see you're supposed to start physical therapy next week. Have you made any arrangements for that, or do I need to make those arrangements for you?
No, actually, Dr. Smith made all those arrangements before I left the hospital.
Great, great, great. Well, we're just going to keep your medications all the same. Do you have any questions or problems you need to discuss?
I don't think so.
All right, well, we'll just see you for your regular appointment in 3 months, unless you need to see me before then.
Okay, sounds great.
All right, well, now it's time for you, Miss Emma. And I see you're here having an earache today. Is that right?
Yeah, she's complained of her left ear hurting all day.
All
so
right.
I thought I'd just go ahead and bring her in this evening.
Well, all right.
With my appointment.
Well, let me take a look at her. All right, sister, I'm going to look at your ears, okay? Here we go. Look in there. Oh, That looks good. Let's look over here now. Let me turn your head up a little bit. There we go. Well, it looks like she does have a little ear infection. Let me pull up her records. All right. I see you're not allergic to anything. Is that still correct?
Correct.
Good. And do you prefer liquid or pills?
Liquid.
Good. Well, I'll just write you a prescription that you can get filled today. What pharmacy do you want to use? I can send it over electronically.
Oh, wow. That saves us a lot of time. We usually use Walmart.
Great, great. Well, I'm going to go ahead and send that over right now then. They'll be ready for you to pick up in about 15 minutes.
Right, thank you.
Yes. 9 o'clock in the morning. Is that going to be convenient for you? All right, we'll see you then. Bye. Hi, Stacy.
Hi.
Did you get everything taken care of?
I believe so. I think we're on the road to recovery.
Well, Nurse Sarah has a way of taking care of people. She does a real good job of that.
She sure does. It's really good that my insurance covers all the services offered here at the Patient-Centered Medical Home. And you know, my copay is a whole lot less than it used to be before I started coming here.
Well, we're glad to be able to provide the service for you.
You know, I did need one more thing before I left. My mother had a stroke this past fall, and she's in rehab and going to be discharged here in the next couple weeks to come live with us. And I really don't know where to start. Do you guys maybe have somebody I could speak to concerning her care?
Yes, actually we do. We have a case manager, and her services are covered under the same service that provides our care for you.
Okay.
And she is specially trained in case management and knows how to coordinate, you know, durable medical equipment and a variety of other things that you might need at home. And she can actually meet with you and then go and meet with your mother in rehab and go into your home and evaluate what you might need there.
Oh, that's perfect.
So, well, her office is here with us, and she's in today. Would you like for me to see if she's available?
Sure, if that's possible.
Okay, hold on just a minute. Virgie, this is Mary Sue at the front desk, and we have Stacey Jones here, and her mother is in rehab, and she's going to be coming to live with her after her rehab's completed. And she has some questions about what maybe she might need. Could you speak with her? Oh, you're available right now? Okay, hold on just a minute. Stacey, can you go see her
Sure.
right now?
Yeah.
Okay. All right, Virgie, we'll bring her right back just in a minute. Thank you. Bye-bye. All right, now, is there anything else that you might need?
I'm so glad that we have the new Patient-Centered Medical Home, because now I know everything's going to be taken care of. You guys just take care of everything.
Well, we are certainly proud to be part of your health care providers. We, you know, care for our patients, and that's what we are. We're your patient-centered medical home. So, is there anything else?
I think there might be one more thing we could take care of today.
Okay.
She's wanted to play soccer in the spring. Can we maybe go ahead and schedule that spring physical?
You know, we had a feeling there was going to be some need for that next week. We have some afternoon appointments scheduled because we were going to see some of our children might need to have physicals. So let's look and see what we have available here. Do you have your calendar?
I sure do. Let me check.
I think we have openings on a couple of openings Tuesday afternoon and Wednesday, and maybe 3 openings Thursday.
Thursday afternoon would be great.
Okay, let's put you in for that then.
Hey, Mary Sue.
Hey.
You know, I really do enjoy our electronic medical record system of keeping records. It is amazing. And the financial incentives that were offered by the Patient Protection and Affordable Care Act have really helped with the cost of the implementation of that system. And I've noticed it's really increased our productivity.
Well, and I think that the incentives for us to stay open later and to have weekend hours, and also the ability to have a lower copay, has really helped our patients. Just what Stacey just said, the copay is much less than what it was before.
Oh, I agree. I agree. And the quality of our patient care has increased. It makes the prices reasonable for the patients. It's been a blessing.
Well, I'm really glad that we have this and it can serve the community with our patient-centered medical home.
Yeah, me too. All right, well, I'm going to go see my next patient.
All right, all right. The patient-centered medical home is a model of primary care that is comprehensive, it's patient-centered, it is carried out by a team of healthcare professionals that is led by either a physician or an advanced practice registered nurse. There are 3 methods of reimbursement. The first is pay for performance, and that is based on the patient satisfaction survey results and patient outcomes data. The second is fee for service. The third is a monthly maintenance fee. The benefits of a patient-centered medical home are improved patient outcomes and increased patient satisfaction. Also, there are decreased healthcare costs, and the number of emergency room visits and acute care admissions are decreased. To find the patient-centered medical home nearest you, contact the Center for Medicare and Medicaid Services.
And as the patient, I have confidence in the care I receive at the patient-centered medical home. And in the end, it's all about me.